will go ahead and begin with some introductions while those of you who are continuing to log on. My name is Elena Dinkin, and I oversee the senior adult programming for the YMCA of Greater Houston. I've actually been doing the Zoom opportunity here with UTHealth Houston when COVID began. And it's a pleasure and opportunity that is wonderful for all of you to learn, to educate, and have better health. So thank you today to UTHealth Houston Ophthalmology for offering us this opportunity for the program. I'm going to ask Janine Lee to go ahead now and introduce our presenter for the day. Thank you so much.
Thank you, Elena. So we are the Department of Ophthalmology here at UTHealth Houston, which is a large comprehensive eye care group located in the medical center. Today we have Dr. Kheirkhah, who will be talking about preventing and treating dry eye. If you have any questions, please put them in the chat and we will answer them at the end. But for now, I will pass it off to Dr. Kheirkhah.
Thank you. Hello, everyone. I'm Ahmad Kheirkhah, cornea specialist with UTHealth Houston. Today, I'm going to talk about dry eye. And this is a very important topic because it's very common. Many patients, they have dry eye. And actually, most of them, they don't know that they have dry eye. They know that the eye is suffering, but they don't know what is the reason. It's actually the dry eye is the reason for that. In addition, it can have significant effects on patients that I'm going to discuss more. So let's start with the definition that what is dry eye. So dry eye is actually a condition of the eye that is caused by abnormal tear film that we have on the surface of the eye. So as you may know, the surface of the eye is completely covered by tear film. Tear film has three components. Has the mucus layer, water component, that's the most important one. And finally, we have the oil layer that is covering the water component and prevents it from evaporation. To know more about dry eye, we need to know how tears are produced in the eye. So the water component is produced by lacrimal glands. So we have a gland here that is producing the water component. The oil component is produced by some glands that we have in the upper lid and lower lid. They are oil glands, we call them meibomian glands. So again, lacrimal gland is in charge of producing the water component, and meibomian glands or oil glands are in charge of producing the oil component. And we have some cells on the white part of the eye that are producing the mucin layer of the tears. So there are many different functions of the tear film. As we know, tear film provides a smooth surface. That's why we have a clear vision. Tear film prevents dryness of the eye when the eye is open. And also it prevents friction when you are blinking. That's why it provides the comfort for the surface of the eye. In addition, tear film provides nutrients and antimicrobials. That's why the eye is healthy. From here, you can conclude that if the tear film is not good, or in other words, the patient has dry eye, the vision is not going to be clear. The eye is not going to be comfortable. The patient is going to feel irritation and discomfort all the time. In addition, the eye is not going to be healthy, that we are going to discuss more about this in a minute. So what is dry eye? Dry eye is when we have abnormal tear film because of decreased production of the tears or increased evaporation of the tears. And actually, most patients, they have a combination of decreased production and increased evaporation. So again, dry eye, whenever we have decreased production and or increased evaporation of the tears. This is a very important and very common condition. Actually, it has been shown that dry eye is the most common reason that patients see eye doctors. There are reports that up to 50% of the population can have dry eye. So you look at the number, 50% of the whole population, especially the elderly, they may have dry eye. So this is a very common condition. And actually, dry eye is the most common cause of ocular discomfort and irritation. So if the eye is not comfortable and there is irritation, the most common reason is always dry eye. And recently, we have seen increased number of patients with dry eye, mostly because of using digital devices like computers, monitors, laptops, iPhones, and cell phones, and so forth. And I'm going to discuss more about this in just a minute. So dry eye is not just a problem of the eye. It has been shown that dry eye can have significant effects on patients' vision, quality of the life, even work productivity and mental health. So it's not an eye problem only. It can affect every aspects of the life of the patient when you have significant dryness. In addition, there is a significant economic burden of the dry eye. Just look at the number that we have. Annually, we are spending almost $4 billion in the US alone on the management of dry eye. So this is a huge economic burden. So what are the causes of dry eye? So as we discussed, dry eye can be produced by decreased production of the tear. So whenever we have an issue in the lacrimal gland, most of the time because of aging or other risk factors that I'm going to talk about them, then you have decreased tear production and it's going to cause dry eye. In addition, dry eye may be caused by increased evaporation of the tears. And one of the more important reasons for such thing is when the oil glands are not working. So when the oil glands are not working, then it's going to be not enough oil to cover the water component, and it's going to be more evaporation. Again, we are going to talk about it in just a few minutes. There are many different and important risk factors for dry eye. Let's review some of them. The most important risk factor for dry eye is old age. Without any doubt, dry eye is much more common in elderly. And as I mentioned, the most common risk factor is old age. Dry eye certainly is more common in women than men. So remember, old age and women. There are other risk factors. A very important one is using digital device. As actually, this is a very important reason. We used to see dry eye only in the elderly long time ago. But right now, because almost everybody is looking at the monitor, computer, laptop, cell phone, iPad, Kindle, and so forth for so many hours a day, we see significant increase in number of patients with dry eye, even in the young people and children. Why? Because they are looking at the monitor all the time. What happens? Normally, we blink every 30 seconds without knowing it. So every 1 to 3 seconds, we normally blink. When we are looking at the monitor or any kind of the digital device, the number of the blink is going to go down. So it has been shown, instead of doing 20 blinks per minute, we just do few per minute when we are looking at the monitor. And because of decreased blink rate, we have more evaporation of the tear. Why? Because the eyes are more exposed. And because of increased tear evaporation, then we get significant dryness. That's why using digital devices is one of very important risk factors for dry eye nowadays. Another risk factor is contact lens use. We know that contact lens is a very important reason for dry eye. And actually, up to half of the patients who are using contact lens, they experience dry eye. Okay. And many patients who they said they cannot tolerate contact lens anymore. It's just because they have dry eye. I'm sure you have seen your friends or family member or yourself that in the past you were comfortable with using contact lens, but right now when you use contact lens, you feel that something is not right. The contact lens is not comfortable, it gets stuck to the surface of the eye. So most common reason is actually developing of dry eye in these patients. Any type of eye surgery can cause significant dryness for patients. For example, if the patient has LASIK or PRK, even if you have cataract surgery, I'm sure you have seen some friends or family or yourself that they have done cataract surgery. Initially, everything is perfect, but after a few weeks, they feel that there is something the eye is not comfortable. It's actually because of the dry eye that may develop after cataract surgery and needs to be treated. And there are so many other surgeries in the eye, such as cornea transplantation, eyelid surgery, glaucoma surgery, retinal surgery, and so forth, that they can cause significant dryness. So just keep in mind that any eye surgery can cause dryness for the patients. Another important risk factor is psychological condition. So we know that many different psychological conditions such as depression, anxiety, sleep problems, PTSD, and even chronic pain syndromes like fibromyalgia, they are associated with dry eye, and actually dry eye can make these conditions worse as well. It's important to note that there are many systemic medications that you take by mouth. They can cause dry eye. Some of examples, if you are taking medications for high blood pressure, medications for anxiety, depression, if you are taking anti-allergic medications, if you are using medications for Parkinson's or so many hormones, they can cause dryness for the patients. Doesn't mean that we are going to stop the medication. No, at least we know that they contribute to the dryness of the patient. In addition to the medications that are used systemically, even topical eye drops that we use for patient, they can cause dryness for the patient. Very importantly, preservatives that we have in different types of artificial tears or other medications for the eye, they can cause dryness. Anti-glaucoma medications, anti-allergic medication, and so many other medications in the eye, they can cause dryness for the patient. Immunologic conditions, they can also be a risk factor for dry eye. There is a condition called Sjogren's syndrome. Sjogren's syndrome is a combination of dry eye and dry mouth. So if you have dry eye and dry mouth, there is a possibility that you may have Sjogren's syndrome. And there are so many other rheumatologic conditions, such as rheumatoid arthritis. Again, they can cause significant dryness for the patients. There are many environmental risk factors for dry eye. If we have low humidity, wind, pollution, high altitude, force, hot air, or using ceiling fan. You may have seen some people, when they use ceiling fan, they feel significant dryness. It's exactly because of increased evaporation of the tears. So environmental factors, they can play a significant role to the dryness of the eye. So what are the symptoms of the dry eye? So some patients may feel that the eyes are dry, but this is not the only symptom. There are so many other symptoms that we can see. For example, we can have a scratchiness of the eye. The eye may have some irritation or discomfort. Grittiness, soreness, very commonly foreign body sensation. The patient is saying that they feel something like an eyelash in the eye. This is a very common symptom of dry eye. In addition, dry eye can affect the vision. And more importantly, you see the vision changes over time. In 1 second, the vision is good. In another second, the vision is bad. So changing vision, changeable vision, transient blurriness of the vision is a very common symptom of dry eye: light sensitivity, tiredness of the eye, and also occasional tearing are the other symptoms that you can see in patients with dry eye. So it's not just the feeling of dryness. As you see, there are multiple different symptoms that the patient with dry eye may have without knowing that these patients they have dry eye. There are some important things to know about the symptoms of dry eye. Symptoms of dry eye are worse in the evening. So if you have some symptoms that they are worse in the evening, it means that you might have dry eye. Symptoms of dry eye are worse with visual tasks. If you read a book for few hours and you feel the eyes are getting irritated, most common reason is actually dryness of the eye. Or if you are using computer and after using computer for a while, you see the symptoms are worse. Again, this is a symptom of dry eye. And symptoms of dry eye are better with blinking and the use of artificial tears. So when you have these symptoms and you come to doctor, in the examination, we can have different findings that they help us diagnose dry eye, such as we can see dry spots in the eye, or we can see that the volume of the tear is not enough, and we can see the inflammation of the oil glands, and also we see that the patient does not blink more often, or when they are closing the eye might be open. And there are some clinical tests that we use again to diagnose dry eye for patients. And these are some of the pictures of the oil gland that again, we can do the testing in the clinic. So that's why, we need to do a comprehensive evaluation of the patient to make the diagnosis of dry eye. Why? Because the symptoms can be non-specific. As I mentioned, if you have discomfort and irritation, the most common reason is dry eye, but still there are other conditions that they may cause the same symptoms. That's why it's very important for us to look at the patient to make the correct diagnosis. So, thankfully, we have many treatment options available for dry eye. Let's discuss about what treatment options we can use for patients. As we discussed, screen use is a very important risk factor for dry eye. That's why we need to do some changes when we are using screens. More importantly, blinking, blinking, blinking. So when you are reading a book, when you are looking at the monitor or your cell phone for a long time, you need to remind yourself to blink, blink, and blink. As I mentioned, we have significant decrease in the number of the blinks when we are looking at the monitor. So it's very important to remind yourself to blink more often, and this is going to help your dryness significantly. There is an important rule to remember. It's called 20-20-20. It means that look at something that is 20 feet away for 20 seconds every 20 minutes that you are looking at the screen. And this can significantly help the dryness of the eye. It's important to set a timer or, just have your cell phone reminder to take some breaks. Again, these are going to help significantly the dryness. It's important to adjust the height of the screen. So the screen should be at the level of the eye or lower. This way the eye is not wide open and it's going to prevent too much evaporation. It's going to help the dryness of the eye. It's very important to consider some environmental changes. For example, having humidifier in home or office next to your monitor. You can have a humidifier. It's going to help your dryness. And it's important to have enough intake of the water. There are some dry eye goggles in the market that you can easily find, or there are some wraparound glasses. They have this kind of the protection to the side of the eyeglasses, as you can see here and here. They provide a seal around the eye. So this way we have less evaporation of the tears and they can help dryness again. So remember, there are some dry eye goggles you can easily find online, without prescription. And it's important to divert the air vents when you are, for example, in the car, home, work, if you have direct blow of the, air to your eye, it's going to cause significant dryness. So just divert the air vents. So this way is going to help the dryness. So as you saw, even before discussing the drops like artificial tears and others, there are so many other things that you can do to help your dryness, including environmental changes. But when it comes to the medical management of dry eye, the first step is to use artificial tears or lubricating eye drops. They are the same. So artificial tears and lubricating eye drops, they are the same, and they are the first step in management of dry eye. I'm sure if you go to any pharmacy or even supermarket, you see so many different types of artificial tears that you can use and you can buy them over the counter. The purpose of the artificial tears is just to lubricate the eye, to provide some artificial tears, to lubricate the surface of the eye. There are so many different brands. We are not going to discuss about the brands, but there are some important principles to know about using artificial tears that I'm going to discuss about them. First of all, we need to know that we have two different types of artificial tears. Some of them, they do not have preservative, so we call them preservative-free artificial tears. And some of them, they have preservatives. When you get the artificial tears, if they are in these single-use vials, they are preservative-free. And when you get them and they are in bottles like this, they are usually preservative containing. So why this is important? As you might remember earlier, I mentioned that preservatives sometimes can cause problem on the surface of the eye. That's why we always prefer to use preservative-free medications, including preservative-free artificial tears. But the issue is that preservative-free artificial tears are more expensive usually than the bottle or preservative-containing artificial tears. That's why if we are using artificial tears only few times a day, it's fine to use either one, preservative-free or preservative-containing artificial tears. But if we are using artificial tears very often because the eyes are very dry, for example, if you are using them every 2 or 3 hours, in these cases, the best is to use just preservative-free artificial tears to prevent problems caused by preservatives on the surface of the eye. Another thing to know about the artificial tears, they have different types. Some of them, they are eye drops. Some of them, they are gel, and some of them, they are ointment. The gel and ointment, they are thicker, and they are going to stay on the surface of the eye for a longer time. But the problem with them is that, they cause blurriness of the vision because they are thick. That's why when we are using the ointment, we usually use it at the night time to prevent blurriness of the vision during day. Very important thing to note that artificial tears or lubricating eye drops are different than redness relief or allergy eye drops. These are completely different. And this is unfortunate to see some patients are using redness relief, something like Visine for dry eye. No, for dry eye, you need to use lubricating eye drops, artificial tears. So don't use the drops that are for redness relief. As you can see here, it says redness reliever, for example, or here again, redness relief. Or don't use allergy eye drops. Allergy eye drops are for allergy, not for dry eye. So use artificial tears rather than redness relief or allergy eye drops for dryness of the eye. In addition to artificial tears that are available over the counter, there are some prescription medications that we can use for patients, and the doctors can give you this prescription if needed. There are so many different prescription eye drops that can be used, or even there are some forms of nasal spray that can be used for patients with dry eye. Another thing that we can use for dry eye is essential fatty acids. As you know, right now, essential fatty acids are used in the medicine very commonly. These are some fatty acids that the body cannot make them. That's why we have to get them from diet. It has been shown that omega-3 fatty acid has significant anti-inflammatory effects, and use of fish oil and flaxseed oil can help the dryness in some patients as well. A very important treatment for dry eye is something we call it tear duct occlusion. Let's go over how the tears are produced one more time. As we discussed, we have a gland here that is producing the tear, and the tears are going to cover the entire surface of the eye. When the tears are produced, they are being drained normally via the tear ducts that we have in the corner of the eye to the nose. So tears are produced here. First, they cover the eye, then they are washed away from the eye via this tear duct that we have in the corner of the eye to the nose. That's the normal pathway of the tears. As you see, the eye is like a sink. You have water coming from here and being drained from here. The same for the tears. They are produced from here and they are drained from the tear ducts in this corner of the eye. In a sink, what happens if you block the drainage? Then you have more water in the sink. The same for the eye. If we block the drainage of the tears, then we can get more tears in the eye. And that's what we call this tear duct occlusion. By decreasing the tear drainage, then we can have increased tear volume and thus lubrication of the eye. So you may ask, so how to block the tear duct? Actually, we have something we call it plugs. Plugs are small devices that we put in the corner of the eye that we have the tear duct to block the drainage of the tears. Some of them, they are dissolvable, and some of them, they are non-dissolvable from silicone, for example. So this is one option. The other option is to permanently close the tear duct. Actually, tear duct occlusion is a very important and effective treatment for dry eye, and many patients, they can have significant improvement after doing this procedure. Another treatment option for dry eyes is using serum eye drops. In this case, we draw the blood from patient, then we make some eye drops from patient's own blood. So we remove the red blood cells and white blood cells from the blood and dilute whatever we have here. And it can be a very good treatment. Why? Because in the blood, we have so many different nutrients that the body needs. That's why they can help significantly the dryness of the patient. And we usually use serum eye drops in patients with moderate or severe dry eye. Another treatment option for moderate to severe dry eye is using special contact lenses. And the purpose of these contact lenses is to preserve more moisture on the surface of the eye. And finally, there are some surgical procedures that we usually use for patients with severe dry eye. My point is, there are so many different options. Even in severe cases of dry eye, we have many options that we can use for patients that can help patients significantly. So we discussed that sometimes the problem of the dry eyes is because of the oil problem. So if the dryness is caused by abnormal oil glands, again, we have some options that we can use. A very good treatment for these patients using warm compress. Then we can also do mechanical massage of the eyelids and also lid margin clinic. So for warm compress, there are so many different devices and eye warmer masks that you can use, and they can significantly help the oil function. And we can use some massage of the eyelid again to help with the dryness of the patient. And in some more severe cases, we can use topical or systemic antibiotics and some other medications to help the dryness of the patient. Finally, there are some procedures that again we can do. So there are many, many, many different ways to help patients with dry eye. So in conclusion, as we discussed, dry eye is a very common condition, very common condition. As you saw in some populations, especially elderly, almost half of the patients, they have dry eye. As we discussed, dry eye can have significant effects on patient. Not only the eye, can quality of the life be affected, work productivity, the function of the patient can be affected. We discussed that there are so many different risk factors for dry eye. And we should remember digital device is a very important risk factor. We use a constellation of symptom and sign and testing to diagnose dry eye, and we discussed that we have so many different treatment options for dry eye. So it has been a great opportunity to discuss with you about the dryness of the eye, and I'm happy to answer any question that you might have. Thank you.
Great, thank you so much. We had a few questions come in. The first one was, I suffer from Fuchs dystrophy. I've also been told my eyes are dry. Part of the treatment for Fuchs is to put saltwater drops in my eyes to cause excess water in my cornea to leave the inside of my cornea. I'm confused and hesitate to use drops for dry eyes since these dry eye drops might have the opposite effect of the saltwater drops that I use for Fuchs. What are your thoughts?
That is correct. The salt eye drops that we are using for Fuchs, that they may cause some worsening of the dryness. But artificial tears are not going to make the Fuchs worse. So for cases like that, it's perfectly fine to use both artificial tears and salt eye drops, but we need to use artificial tears more often than usual for the dryness of the eye.
Perfect. And how do I manage dry eye if I also want to wear contacts?
So actually, we prefer not to use contact lens until the dryness improves. So that's why we need first to treat the dry eye. Then after dryness improve, then we can use contact lens. Because as we discussed, contact lens may cause worsening of dry eye. So it's better to see the doctor first to treat the dry eye more likely with prescription medication. And after that, they can use the contact lens.
Perfect. Is it true that there are numerous treatments, but none can cure dry eye syndrome?
That is 100% true. The same for like high blood pressure. You can control high blood pressure, but you cannot cure it. The same for the dry eye. You can control it and manage it, but you cannot cure it. That is correct.
If I had retinal detachment, is that related?
No, there is no relationship between retinal detachment, but surgery for retinal detachment, as we discussed, like any other surgery in the eye, may cause some dryness of the eye.
Great. And how do I manage, or what happens if I don't treat any dry eye symptoms?
So if it's mild dry eye, you are going to just continue to suffer from dryness, but it's not going to hurt or harm the eye permanently. But if it's more severe dry eye and you don't manage it, you may get scratches in the eye, and scratches, they may get infected. That's why it's better to treat dry eye. For the mild dry eye, if you don't treat it, you are going to suffer, and it's going to have significant effect on the quality of the life and your function. So it makes sense to do treatment.
Great. And should dry eyes be treated before or after cataract surgery?
Oh, this is a very good question. I'm glad that they asked this question. If you have dry eye before cataract surgery, it's going to get significantly worse after surgery. That's why it needs to be treated before surgery for sure. And when dryness gets better, then you can have cataract surgery. Otherwise, you are going to have significant dryness after surgery. Still, we can treat it, but it's always a good idea to prevent it rather than treat it after surgery. Very good question.
Perfect. And the last one, I had excessive tears causing blurry vision and the excess tissue was catheterized. What are your thoughts?
So there are multiple reasons that you might have excessive tearing. One of them is because of the excessive tissue, but there are so many other reasons for epiphoria, or we call it, or tearing of the eye. That's why first we need to find out what is the reason for tearing and then treat it accordingly. Without seeing the patient, it's difficult to say what is the reason and what is the management for the tearing.
Perfect. And then I saw somebody asked about a copy of the presentation. There will be a recording. Oh, one more question came in. Artificial tear brands have different ingredients. How do I know which one is appropriate? And other doctors have asked me to try different kinds.
So this is important thing. I didn't go to the details. The thing that is much easier for patients, we usually ask patients to try different brands with different ingredients to see which one is more comfortable. This is the thing that most patients they do, and I think this is the easiest way to answer this question. Otherwise, there are so many details about what to use for patients that can be challenging for patients. So my answer is going to be just try different ingredients to see which one is more comfortable for you.
Great. I think those were all of the questions, but I'm going to put our contact information in the chat again in case anybody has questions in the future.
Great, thank you.
Well, thank you so much. I know this was a very powerful presentation and resonated with so many people, especially us who are prompters today, because we use the computer and the phone all the time. So we all got some great tips. Again, we will be sending out the recording. Thank you so much to UTHealth Houston Ophthalmology and Dr. Kheirkhah for taking the time to put this together. Everyone, again, will be receiving the recording. So I say goodbye, and for everybody to have a good rest of the day. Thank you so much. Bye-bye now.
Thank you. Thank you.